Hello, I'm Dr. Ruth Roberts, your pet's ally. I hope you're doing well today. And I've got an interesting topic, or one that interests me anyway. So, we talk about treating all sorts of diseases in dogs. And um, the thing that gets frustrating is arthritis is a huge issue in pets, both dogs and cats. And the thing that is really frustrating to me is that much like, like cancer or obesity or any other thing you can think of, it's a disease often of lifestyle choices. And so this is where it gets super frustrating. So I want to go through a couple of sort of the known causes of arthritis. And so certainly when you think about dogs that are really athletic, that, jump and run and turn and spin and all those good things, that's where we'll have, a lot of those issues show up. So that's one of those things you want to keep in mind. If you've got a young athletic dog, play ball with them. If you're going to play frisbee, don't throw it so they have to jump up real high and catch it and spin around. That's super cool to watch. But on the other hand, too, it is not very pretty when they crash and land. And that's where a lot of these guys end up tearing up cruciate ligaments and things of that nature. So that's really not cool. The other thing is rapid turns. So just like us with humans that play tennis, that everybody's had that instance or knows somebody that's, played for years, and then all of a sudden they just take a wrong step and bam, there goes a cruciate ligament. Same thing happens in dogs. So again, if you're playing ball, things like that, roll the ball, not too many high joints, that's where they blow cruciates out, and then that sets them up for developing arthritis in that joint. So this is where, golly, just use some common sense here too. Obesity is another big thing. So certainly there's impact on the joints just from the excess weight that's being carried. But the other thing is the fat cells actually store pro-inflammatory things, molecules called interleukins and other things of that nature. And so if your pet's obese, you're actually going to allow them to create more inflammation and do more damage to the joints over the time. Interestingly, spaying and neutering actually does contribute to these as well. The UC Davis study that was done probably 3 or 4 years ago, actually it's probably longer than that, looked at both Goldens and then a second study, Goldens and Labradors, where they reviewed medical records. They found things like unneutered male golden retrievers do not have cruciate tears. Any of you guys that have male Goldies or Goldies in general know that that is one of the most difficult things for Goldies to deal with. They blow those cruciate ligaments out left and right. And then the other thing is that creates an immune-mediated disease. So the surgeon always tells you, oh, they've blown one, they'll blow the other one later. And what's happening is there's a unique collagen in that cruciate ligament that once it's exposed to the immune system, once there's like a minor tear in the opposite knee, all of a sudden, bam, that the immune system goes to work on that ligament, and your dog may do something really relatively trivial, like turn gently, and then boom, there goes the cruciate ligament. So it's really frustrating. And as Karen is saying, the cruciate, her dog Dino's had a torn cruciate that's healed twice, and it's never been the same. And that's what happens. Once you break something, we can put it back together, but it's never quite the same. The other big thing is autoimmune diseases. So I just mentioned the one about cruciate ligaments in particular, but this is sort of a general issue. There are autoimmune diseases that attack the cartilage, and this is part of being in that constant inflammatory state. So and then certainly pro-inflammatory diets, super high carbohydrates, they just carb diets are just going to allow your pet to continue to create more inflammatory molecules because they just can't deal with them. So that's another thing that's really super important, is to use an anti-inflammatory diet like the original CrockPet diet. And then, finally, just that chronic inflammation, as we were just starting to talk about, that ends up creating destruction of the cartilage itself. The synovial fluid becomes filled with pro-inflammatory molecules, which hasten the breakdown of the joint disease, creates physical inflammation where you can feel swelling within the joints, all of those kind of things. And then and so that begins to limit mobility because it hurts to walk. And so you'll see them taking smaller strides, moving less. So this lack of mobility then starts to contribute to loss of muscle. And when you start to, things really go to hell in a handbasket. Same thing with humans. If you lose mobility and you have difficulty moving again, then everything starts to stagnate. And so that happens in your joints and your big muscles, things of that nature. It becomes more uncomfortable to walk. And it's just it's not fun. And so that's the thing that's so important to do, is to continue improving mobility so that your pet can maintain muscle, stay stable as they're walking. For us, as we age, that's what makes us fall over. For the older guys, that's where you'll see them, they're like rigid when they're walking across a slick floor because they don't have the muscular ability to hold themselves anymore. And so that's where things like toe grips or shaving the bottom of the pads to remove that excess can be very helpful. Certainly, I'm going to tell you that an anti-inflammatory diet, is going to be very important. Removing things from the diet that are going to exacerbate inflammation. So the reason that the original CrockPet diet is anti-inflammatory is that it's got a more appropriate mixture of macronutrients. So it's about a third protein, fat, and carbohydrate, most of which are in the form of complex carbohydrates, which are vegetables. In those vegetables are brassica species, so broccoli, kale, all of the stuff that is big in the news right now to eat. And the reason is that they provide phytonutrients that help the liver get rid of gross, yucky stuff that creates more inflammation. And so by doing that, the general level of inflammation in your pet's body goes down and things start to feel better. So the other things you can certainly do are to use joint supplements, as long as your dog or cat, and then use things like probiotics, which help to reduce inflammation by the good guys producing more anti-inflammatory molecules, and then fish oil or krill oil at a high dose. So that's kind of the basic take-homes here. I've got a couple of questions in here. And so Terry's asking if hot proteins would exacerbate inflammation. And so yes, technically. However, if your pet's, sensitive to other things like pork or turkey that are cooler in nature, then that might create more of an issue as well. So you got to figure out what works well for you and your pet and kind of go from there. So the other thing, I'm sorry, I'm still having trouble figuring out how to get to the comments section. Let's see if I can get in here. And unfortunately, no, I think I did see something about heart disease. And interestingly enough, this is a disease of inflammation. Again, it's just in the heart muscle and that kind of stuff. So, and hips are the other big place where there's inflammation and discomfort come. And guys, this is not just dogs. It actually is in cats as well. So this is important to remember for your cats, especially as they get older. So a good joint supplement can also include green lip mussels, and I think that's a great one to include. The reason I said to avoid them if your dog or cat has sensitivity to chicken is that most of the glucosamine and chondroitin are derived from chicken. So it's really important to make sure that you're feeding your pet what's going to help and not what's going to hurt. So I hope that's all making sense. What else can I tell you? Again, most of this stuff is things that we discuss with our members in the CrockPet Chefs community on Facebook. And if you haven't started doing CrockPet diet for your pet, they will tell you that, yes, it seems daunting, but golly, once you get into it, it really doesn't take that much time. And what they see in their pets is dramatic improvement in health. So right now we've got 50% off all the do-it-yourself holistic health programs, including the original CrockPet diet. There's my gut health program. So if you got a dog or a cat that's got some significant GI issues or other major inflammatory issues, so things like, again, joint disease, skin disease, things of that nature, those are related to leaky gut syndrome. So if you can fix the gut, oftentimes you can fix the other problems as well. So I'm going to roll through here and see if there's a couple of more questions. Glad to see so many of you guys coming and hanging out and checking this out with us today. So if you all have any other questions, get them up there now. And otherwise, I will see you next week. And Sherry, I'll address that question about carrots in the CrockPet Cooks community. That's sort of on the list of stuff to do. And then Ann Gibbons is asking about how much fish oil for a 75-pound pit bull. And that, so you want to use about 100 milligrams per kilogram or 50 mgs per pound of body weight of omega-3 fatty acids. So remember, when you look at a fish oil bottle, it'll tell you it has something like 1,200 milligrams of fish oil in the capsule, and then generally somewhere around 300 milligrams of omega-3 fatty acids. And so for that reason, I really recommend our CrockPet fish oil, because a teaspoon will deliver 2,800 milligrams of omega-3 fatty acids, and they're extremely good at getting out the PCBs and other heavy metal contaminants and things of that nature. So that's what I've got for you. MSM that was another question about MSM and joint supplements. MSM is a synthetic. And so again, if your pet has sensitivities to to chicken, then that's a great thing to use by itself. So that's what I've got for you this week. And Franklin's asking about his little Shih Tzu, and she's got some congestive heart failure and cough. And Franklin, that really stings. Come on over to the CrockPet Cooks community in a few minutes, and I'll get that question answered for you as well. So, ladies and gentlemen, have a fantastic day. Until next week, remember, your pet's best health truly starts in the bowl. Take good care. I'm Dr. Ruth Roberts, your pet's ally.